Thanks, James Suleberg, for talking to us today about YFA. What is YFA?
The YFA is the Young Fellows Association. It's a subdivision of the American College of Surgeons that is targeted towards engaging surgeons who are in practice in the first 10 to 15 years of practice. We're targeted for members of the college less than 45 years old, and of course all members who are young at heart as well.
And part of your effort now is to get them to use social media and trying to get some more engagement online, right?
Yeah, absolutely. So we want to get the message out that the college is providing great value in membership and being a fellow of the college. And as part of that outreach opportunity, we want to engage young surgeons through the different social media channels.
Mm-hmm. And so how are surgeons presently using those various channels?
Yeah. So social media can really be an integral component to your professional practice. There's a few things that are real important to remember. It's important to own your profile on social media as a professional surgeon in the community. And when you own that social media profile, you can then use that to disseminate info about the disease processes that you treat, the hospital systems you work at, and the practice that you run. It's also a great way to disseminate information to your patients. Now, a lot of surgeons are concerned about having professional social relationships across social media and the conflict that can obtain. But the savvy social media user is able to establish these professional profiles and really utilize them to distribute information about their disease processes that they treat and really integrate them into the marketing for their professional practice.
Mm-hmm. And how about how surgeons are using social media to talk to one another?
Yeah, so one huge success of the American College of Surgery in the past year to year and a half has been the online ACS communities. And those posts have really exploded and demonstrated that we really have a tremendous power in our community of surgeons, both nationally and even internationally.
Yeah.
The YFA realizes that different forms of social media outreach are different for certain populations of surgeons. And we want to take to using traditional social media platforms like Twitter or Facebook, for example, which are really utilized heavily by surgeons that are probably less than 45 years old, as a way to communicate to that membership.
And can you give some examples of people using Twitter or Facebook now?
Great, yeah. So there's actually a great journal club that runs across Twitter right now called the Surgical International General Surgery Journal Club, and monthly they'll actually have discussions about a different journal article, open that journal article up to free online access for 48 hours, and have a dialogue across Twitter regarding those important CME updates. They're soon going to be moving to where surgeons can even obtain CME for participating in such journal club activities. So that's a great example of how to integrate education and professional improvement into your professional practice through social media.
Nice. So what else do you want the world to know about YFA and social media?
The main thing we want to know is that we want the world to know is that the Young Fellows Association is out there. We're working hard to represent the interests of the American College of Surgeon membership less than 45 years old. We're going to be debuting some Twitter channels as well as Facebook channels, and we want all that membership to engage and either like us on Facebook or follow us on Twitter.
Great. Thanks for talking to us today, Dr. James Suleberg.
Thanks, Chris.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.